Welcome. This is a case study on how movement therapy changed one patient's life. Every minute, someone dies from complications related to high blood pressure. But one woman reversed her dangerously high numbers, not with more pills, but with movement. This is the story of how movement therapy, not medication alone, helped her regain control, confidence, and her life, and the surprising science behind why it worked. Welcome to this powerful case study on controlling hypertension through movement therapy. Lila, 58 years old, female, a retired school teacher, kind-hearted, but for years, her heart was under siege. Diagnosed with stage 2 hypertension, Lila's blood pressure often spiked to 160 out of 100 millimeters of mercury. She was constantly tired, dizzy, anxious, and afraid. Her doctors added a second medication, then third, but side effects were harsh. She asked, "Isn't there another way?" That's when Lila was referred to a functional wellness center. Instead of upping her dosage, her care team introduced her to movement therapy, a science-backed blend of therapeutic exercise, breathwork, and mindful mobility. Think yoga, tai chi, functional stretching, light cardio, all customized. Movement therapy addresses hypertension by reducing vascular resistance and improving circulation. But more importantly, it activates the parasympathetic nervous system, lowering cortisol and relaxing the blood vessels. It is not just physical, it is neurological, hormonal, and emotional. Now, studies show that just 30 minutes of mindful movement, 5 days a week, can lower systolic blood pressure by 8 to 10 millimeters of mercury compared to a low dose of medication. Now, Lila's 8-week protocol included, it was designed in 3 phases. Now, week 1 was grounding and breathwork. There was light stretching, diaphragmatic breathing, 15-minute guided mobility sessions. That was week 1, grounded breathwork, light stretching, diaphragmatic breathing, 15-minute guided mobility sessions. Then week 3 to 5, that is the second phase, chair yoga and dynamic balance drills, breathe to movement sequences, and daily walking of 20 minutes. That is week 3 to 5 in the phase 2, stability and flow, chair yoga and dynamic balance drills, breathe to movement sequences, daily walking 20 minutes. Then week 6 to 8, it was for strength and cardio integration through the resistance bands for muscle tone, 30 minutes of brisk walking, daily heart rate tracking. That is week 6 to 8 in the third phase of Hurry-Up protocol. Resistance bands for muscle tone, 30 minutes of brisk walking, daily heart rate tracking. That is for the week 3, and that was her rehabilitation. Lila also tracked her blood pressure daily, By week 8, her average readings had dropped to 124 out of 82 millimeters of mercury. Her energy up, sleep improved, anxiety almost gone. What stood out wasn't just the drop in blood pressure, it was the patient's sense of empowerment. Her compliance improved, her inflammation markers went down, movement reconnected to her body and gave her agency. Her medication was reduced by 50% from the baseline medications that she had, and for the first time in years, her heart rate variability, a key indicator of cardiovascular health, normalized. Now, from Lila's quote, she said, "This wasn't just therapy, it was transformation. It didn't just lower my blood pressure. I raised my expectations for what life can feel like. I used to be afraid of my body, now it's my partner." Now that's what Lila had to say after her therapy. Now the key takeaways: Lila's story isn't just rare, it's just undertold. Movement therapy isn't a miracle, it is medicine, real, effective, and too often overlooked. The key takeaways include: movement can be prescription strength, small, consistent efforts leads to big clinical wins, integrative care empowers patients, not just treats symptoms. If you are treating hypertension or living with it, remember, medicine helps, but movement heals. Prescribe motion, restore balance, redefine what health looks like.